The side effects of treatment are affected by the treatment option you choose. And for a lot of patients, the outcomes are fairly similar between the different treatment modalities. So what you're doing is choosing between the different side effects. For external beam irradiation, again, I'll see you once a week during treatment whether you need me or not, just to see how things are going. But you'll notice the side effects will slowly develop. For a week and a half or so, you don't notice anything. And as time goes on, you may start to develop a little bit of fatigue. If you're working, I'd say keep working, it's not that bad. You can have local hair loss, just pubic hair, local skin irritation, maybe some itching, no blistering or anything like that. And then you will have some degree of urinary and rectal changes, and it's just a matter of degree. Some patients will go through a treatment with minor irritation, some patients will be asking for medications, and that's probably only 20%. What kind of things will you notice? Urinary urgency, frequency, irritation, and hesitancy. Okay? With the rectum, you might notice some urgency, irritation, and frequency as well. Most patients don't have frank diarrhea because we're not treating a very big field, but what they do have is an irritated rectum, and that irritated rectum doesn't allow as much stool to collect, so you have more frequent bowel movements throughout the day. So 2, 3, 4, or 5 instead of 1 or 2.
The main side effect of that is that with the radiation, as well as with all the needle sticks, there can be some swelling of the prostate. That swelling can cause difficulties with passing urine, such that a percentage of men, even up to 10%, will require a catheter that they go home with. The vast majority of men will get that catheter out within days to a week or two, but a very small minority will need a catheter for a long period of time because of swelling blocking off the urethra or urine tube.
Over the long term, most people recover completely normal function. Some patients, about 10%, will have some degree of urinary urgency, frequency, or irritation that persists. And some patients will have some degree of change in their bowel habits, sometimes called a bowel bother, just because it's different from what it was. You can also have a radiation proctitis, inflammation around the rectal wall, which causes small amounts of bleeding. I've never seen clinically significant bleeding, but you might notice some spotting on the paper or in the toilet. If patients present with this after treatment's over, could be 12 or 18 months down the road, we usually ask them about more significant things like a history of colon cancer and send you even for a colonoscopy to rule out more significant things. But typically it'll go away on its own as time goes on. Some patients can develop impotence, a loss of erections after radiation. If you're fully potent ahead of time and then have external beam radiation, probably 50% of patients can have erectile difficulty in the future. Doesn't happen right away, but it can be 12 or 18 months again down the road. With that, the good news is that 3/4 of patients will respond to the drugs like Viagra, Cialis, Levitra. And as long as we know about it, we can help you out with that. Anything more significant than that, we send you back to the urologist to address. Incontinence or leakage is not an issue for external beam radiation, with less than 1% of patients having a problem. Also, patients rarely need a catheter after external beam radiation unless they needed one before. For the interstitial implant, again, the goal is the same, to radiate the prostate, but you radiate it from the inside out. These radioactive seeds, the iodine-125 pellets, give off an extremely high dose of radiation, but it doesn't travel very far. It's kind of like having a ray gun, but you have to be within 2 inches of the barrel to suffer any damage. But because the prostate is between the bladder and the rectum, again, we can have some side effects. With the initial implant, after you wake up, you'll have, number 1, you'll have some blood in your urine. It'll last 3 to 5 days. Number 2, you will go home after you wake up from the anesthesia. However, if you cannot urinate, you go home with a catheter, and that happens about 10% of the time. Sometimes patients will go home after they urinated okay in the hospital and have a problem with blockage or obstruction, and they'll have to go back to urgent care or ER and get a catheter placed. That's about 5% of the time. Anytime you get either one of those catheters, it's usually you keep it in place for 48 hours. Some patients will have urinated okay in the hospital, but then have difficulty at home. That can be due to a blood clot or just generalized swelling of the prostate. If it happens, you have to go back to the emergency room or an urgent care center and get a catheter placed. If you get that catheter or the one that you left the hospital with, typically that stays in place for 48 hours. Some patients, though, are unlucky. Up to 2% of patients can have long-term urinary retention. Long-term for us means anything longer than 2 weeks. And that means wearing a catheter. But that could be 6 months or 12 months. You know, it's not life-threatening, but it sure is annoying. Again, the urinary symptoms that we talked about with external beam radiation, you can have these after an implant as well. Urgency, frequency, irritation, hesitancy. You notice them right away after you wake up. That's the difference from external beam radiation. However, after you notice them, they can actually get worse. They peak at around 2 to 4 weeks and then slowly get better. Most patients tell me that by the time they hit 6 months, they urinate about like they did before they had the implant. Two of the things that can linger on the most are a slow stream and some burning with urination. But it's possible to have frequency, urgency, irritation that's very annoying that persists into the future, and that's up to 10 to 15% of patients. With the rectum, that anterior rectal wall gets a high dose because it's right on the other side of the prostate. The rest of the rectum gets almost nothing. But because that gets such a high dose, you still get the same symptoms you can get with external radiation: urgency, frequency, irritation. Okay? Again, not diarrhea, but smaller, frequent bowel movements. Also, again, in the future, you could have a radiation proctitis, inflammation of that wall causing small amounts of bleeding. Again, I haven't seen clinically significant bleeding, but it's possible. Also, because it gets such a high dose, you can actually develop an ulcer there. Again, I've never seen one of those, but again, it is possible, and I've read about it in the literature. Erections are actually affected less than with external beam radiation, and only 30% of patients that are fully potent ahead of time will develop impotence in the future. And again, that takes some time to develop as well, and we'll follow that with time. With incontinence or leakage of urine, the incidence is greater. The chance is up to 5%, but it's typically small amounts.